Hey everybody, it's Rebecca Schroeder, Brady's mom and National Advocacy Co-Chair for the Cystic Fibrosis Foundation. I just wanted to check in with everybody. There has been sort of a lull in the conversation since the bill got handed over to the Senate after it was passed in the House. And I guess I just want to encourage all of you to keep talking through this lull because it's really important. And we need to keep the conversation going. I think that this bill is really dangerous for everyone living with cystic fibrosis and so many other conditions. And I've been talking and asking questions at town halls in Idaho. And, recently I met with my representative, Raul Labrador, who has some really disconnected ideas about healthcare. And I'm going to link our discussion that we had in the town hall. But in that exchange, he commented that we had been meeting about healthcare and having good meetings, even when we disagreed, for the last 7 years. And he couldn't understand why I am so upset now, and why our last meeting I was crying and so upset, and when I was in the town hall I was upset, and why I'm writing letters to the editor upset, and why he can count on me getting more upset. And I guess in that discussion he said, we fundamentally disagree. You think Obamacare is the answer, and I disagree. And I was, I immediately said, no, that's incorrect. That is not where we disagree. I have never, ever claimed that Obamacare is like the perfect plan. We absolutely need to continue to improve on it as a family that utilizes the healthcare system constantly to care for our son's needs. We need to keep improving. The point that I disagree with is what constitutes protection for my son, and what constitutes protection for people living with all types of pre-existing conditions. When you allow insurers to discriminate against people and charge them more, we are no longer protected. Discrimination by insurers is actually the opposite of protection. And being forced into high-risk pools where there's lots of evidence and lots of data about how inadequate those were at caring for those populations that they were supposed to support, this does not constitute protection as far as I'm concerned. Limiting our choices, forcing us into high-risk pools because we are discriminated out of the individual market is not protection. That's where I disagree. And it makes me so upset when I am placed into some sort of box, political box, because I stand up for what my son's medical needs are. That doesn't make me a Democrat or a Republican or anything else. That makes me a parent of a child with some really complicated healthcare needs. And those are just our reality. It's not a political issue. And it upsets me when people try to tie some sort of political association to it. So keep talking. I'm reaching out to my senators pretty much daily and communicating via email with the health aides that I meet with personally when I go to Capitol Hill. I'll be there next month, and I intend to hold them responsible for what they do with healthcare over the coming weeks, and I encourage you all to do the same.